Hello, everyone. My name is Fatima Loren-Dreyer, Executive Director of the Health Alliance for Violence Intervention. I want to thank you all for joining us for Champions of Change, charting a path forward to end community violence. Next slide. We have an incredible lineup of speakers who have made commitment to addressing violence as a public health crisis. They hail from a range of professional backgrounds and lived experiences, but share a passion for fighting to end violence without increasing harm from the criminal justice system. I will offer a few opening remarks and allow them to share their stories and vision with each of you. When we conclude, we may have some time for a few questions, so please feel free to add them to the Q&A section, and we will get to as many as we can. Next slide, please. Violence is a public health crisis, is now the leading cause of death for children, and Black young man is 19 times more likely to die by homicide than his white counterpart. The HAVI supports over 85 cities with high rates of violence, build thriving community hospital partnerships to address community violence. We offer training and technical assistance to help build new programs. You can advance the slide, please. We convene researchers to help build the evidence. You can advance. You can advance once more. We support existing programs with monthly skills building and ongoing opportunities for peer learning, and develop policies and work in coalition to advocate at the local, state, and federal level. And finally, we help change narratives that ensure that violence is treated as a public health crisis and humanizes those who've been caught in cycles of violence. Next slide, please. I'm here to share three important messages. First, we can end violence with a decisive strategy. Two, we have found that there are some significant signals that bipartisan support is there to help scale community violence intervention. And finally, it will take all of us across sectors to achieve transformation in the United States. So let's look at each of these key messages one by one. Next slide, please. All right, let's start with what it will take to end community violence. Next slide. So there are certain social problems that may be distributed more evenly across the population, but this is not the case with violence. Community violence follows a predictable pattern because it arises in communities that have seen systemic neglect, including disinvestment, redlining, and other contributors to systemic racial inequity. As such, a 2015 analysis found that roughly 50% of homicides occurred within 127 cities in the entire United States. And further, within those cities, it's highly concentrated within specific neighborhoods. And further, researchers have found that roughly a fraction of a percent of individuals within a given city are witnessing, experiencing, or even using violence. In other words, there's what we see as a contagion effect in which exposure to networks of peers caught in cycles of violence may predict some future percentage of violence. Next slide, please. There is a sprawling literature on community violence and solutions, and Arnold Ventures has funded a star-studded group of researchers in criminology, public health, sociology, and more to review the science on intervention efforts to address community violence. And they found that there are 7 key recommendations for how to actually mitigate the impact. The first is improving the physical environment. The second, strengthening anti-violent social norms and peer relationships. The third is engaging and supporting young people, reducing substance abuse, mitigating financial distress, reducing harmful effects of the justice process, and confronting the gun problem. Hospital-based violence intervention programs not only help strengthen anti-violence social norms and peer relationships, but they address some of these other important interventions, reducing substance use, engaging with youth, And on a systems level, we've seen examples of hospitals and health systems engaging in mitigating the impacts of financial stress and improving the physical environment. So it's exciting to see that there's some real opportunity to engage hospitals and health systems in this larger fight, in addition to the work of individual engagement and interaction. Next slide. So included in their review were community violence intervention strategies that comprise what we now call a community violence intervention ecosystem, CVI. Next slide. And hospital-based violence intervention is one component of that larger ecosystem. Next slide, please. So why are hospital-based violence interventions so important? Well, it's because hospitals are critical access points to reach a small number of individuals that are caught in that cycle of violence. They are really hard to reach, and hospitals not only see a lion's share of shooting victims, they also treat the roughly 30% of patients who then return to the hospital as a victim following an initial injury. So this is a critical access point. Next slide, please. From that point of access at bedside, hospital-based violence intervention programs deploy credible messengers called violence prevention professionals to provide intensive case management that's long-term, which includes housing relocation, safety and retaliation support, educational assistance, and so much more. Next slide, please. And this fall, the HAVI will be releasing standards and indicators for our work, including 43 standards across 8 domains. This work will help clarify model fidelity, and we hope to see more of this emerge in the broader field of violence prevention across many different strategies. Next slide, please. This work includes highlighting key principles, including centering community leadership and employing credible messengers. To zoom back out, I want to impart that to solve the problem of community violence, we must deploy systems thinking because it is the ecology that impacts violence trends in the long term. So how do we do that? We must deploy a systems dynamic approach, much as researchers have done in HIV prevention. As you can see in this slide, city by city, it's possible to model a range of preventions deployed over a time period, let's say 10 years, projecting the kinds of reductions we can sustain in the long run. The HAVI is working to launch and different ways of doing ecosystem modeling to help drive research and recognize that it's going to take many different strategies over longer periods of time to truly understand what will drive down violence. Next slide. So I mentioned that we want to discuss 3 critical signals that we see that indicate broad support, broad bipartisan support for community violence intervention. The first signal is significant national attention on solutions. This is critical because while many national and local media outlets cover violence, they certainly are not covering how and what we can do to address the scourge. We are particularly interested in news sources elevating the role of our credible messengers who are making a difference and impacting the lives of those who are at very high risk of violence every single day in communities across the country. Next slide. There are also more national champions entering the fight and focusing on how fields like tech, healthcare, and policy can address the scourge. You may see a few familiar faces and names here, including Steve Ballmer, former Microsoft CEO, and several of our speakers today. The next signal is public sentiment. Data for Progress, in partnership with the HAVI, conducted a nationally representative poll of likely voters to better understand their views on community violence. The complete results are available on our website for your review, but I will highlight a few important findings. First, violence is a concern that impacts all voters, with 62% feeling very or somewhat concerned about violence. But it's clear from this slide that this is an issue that disproportionately impacts communities of color, with 50% of Latinos and African Americans saying they're very concerned about violence in their own communities. We also find that voters across the political spectrum believe that reducing violence is possible, and they don't accept that violence is just a reality we have to deal with. We've also found bipartisan plurality prefer to focus on community violence intervention instead of over-policing communities. Now, if we look closely at this slide, you'll see this gray area, the folks who don't know. And when I see that gray area, I see an opportunity to target those who might be on the fence with very targeted campaigns that bring an even greater majority of people supporting public health approaches to violence. Finally, we see that roughly 2/3 of voters want Congress to provide more funding for community violence intervention. This is true across racial groups and across political affiliation, which is very exciting for us. Our third signal is our political momentum. We have seen over the past few years on the federal level tremendous change, and we have in President Biden a true champion. But I want to note that during the Trump administration, we found that they've greenlit new funding for violence prevention research, and that momentum has only continued. In July, President Biden signed the Bipartisan Safer Communities Act, which, among many other things, offered new funding for implementing community violence intervention strategies. 10 Republicans in the House and 15 Republicans in the Senate were supportive of this legislation. On the right, you see some new news about a policing and public safety package that will be introduced that will include a $5 billion allocation for community violence intervention work, as well as other policing accountability measures. So very exciting work is still yet to do at the federal level. At the state, local level, we're seeing tremendous progress and investment. We've seen increase in support through the American Rescue Plan dollars, which we know are short-term, but we've seen many governors and mayors allocate funding to implement community violence intervention locally. One campaign that's been led by the HAVI is the use of Medicaid to reimburse violence prevention services. We have launched or advised coalitions for campaigns to secure Medicaid for that, and we've been successful in about 5 states. Once passed, we continue to work with states to implement the policy and ensure that funding sources is accessible to those working on the ground. Remember, this becomes an ongoing, sustainable funding source for programs, which helps them diversify time-limited grant support. While this can't be the only source of funding, it's certainly a very important one. We are incredibly proud at the most recent passage of the Medicaid bill in California. It is the largest state to date to secure the benefit. We've been working on the California campaign for several years, and we want to thank our member program, Youth Alive, and California Funder for supporting us when no one else really even understood what this campaign's potential could be. Overall, we've seen dozens of Republicans support these bills across states that we've worked in, and now we have half a dozen new states interested in introducing similar bills in the next cycle. So it's very exciting. So it will take all of us to realize this transformation. And I'd like to turn our attention now to our incredible speakers who are leaders in this field and have played many roles in this fight. Please join me in welcoming our first speaker, Michael Dowling, CEO of Northwell Health. Michael,
thank you, Fatima. And first of all, I'm delighted to have the opportunity to be with you for a period and to listen to the other speakers. And it's also a pleasure to be in the presence of a number of your other speakers who I know are very emotionally attached to this issue and are making major contributions. But let me begin by congratulating HAVI. You have done phenomenal work. Your understanding of local communities, your understanding of how to deal locally with populations of and communities of color, your relationships with local CBOs, and your continuous publication of the portfolio of activities that can be pursued locally is absolutely wonderful. And to you, Fatima, for your passionate leadership here, I want to say a special thanks to you. So I'll be relatively brief, but I'm a big, strong believer that whether you're a healthcare organization or a non-healthcare organization. And if you're the leader of that organization, you've got two basic roles. You've got an internal role, which is to make sure your organization is doing the right thing and doing what it should do, and that it is successful socially, morally, and of course, financially. And that's where you spend an awful lot of time inspiring your own employees, hiring the right kind of people, providing an opportunity for growth and diversity in terms of your employee base, et cetera, et cetera. That's where most people spend most of their time. But I also believe strongly that leaders of all organizations have an external role. And that's the question of what you do broadly to improve the community that you're involved in. And that community can be small, or it can be regional, or it can be national. In some cases, it can actually be international. So you have an external responsibility, in my view, to do those things and engage in those things, become a catalyst, become an advocate, to create a better sense of community overall, to get engaged in advocating for public policies and for broad issues that affect the community at large. That's in many ways, in my view, what leadership is all about. It's about stepping out of your comfort zone and doing things that other people say, well, why did he do that? And then if you step out of your comfort zone, then other people will follow. So all of us in leadership roles, whether it's a hospital system or a hospital or a non-healthcare entity, I think we have a responsibility. And fortunately, in many arenas over history, leaders have stepped out of their comfort zones and made a difference. And now it is needed more than ever before, especially as Fatima just clearly enunciated in the issue of gun violence. And I will, again, especially for healthcare organizations and for hospitals, I will, reiterate the statistic that Fatima mentioned, because it stands out and it surprises people. I presented yesterday to a large group of people, and when I mentioned this statistic, they were absolutely stunned that it was truthful. And that is that gun violence is the leading cause of death among children and adolescents these days. Second leading cause of death, as everybody knows, is automobile accidents, and the third leading cause of death is cancer. So when you make that statement, it resonates, which of course clarifies the fact that this is a public health issue. And when I got involved in this years ago and went very, very public, I got many calls and nasty letters and communications where I was told, why don't you stay in your lane? And my question was, well, what is my lane? And they said, well, your lane is stay in the healthcare space. I said, this is my healthcare space. Gun violence is a health issue. It is a public health issue. And it is getting worse. It's not getting better. And it has been worsened since COVID. We all know the statistics with this audience. I don't need to go through the massive increase in gun ownership, et cetera, et cetera. So we cannot be standing on the sidelines. And I would basically say to every healthcare organization in the country, you cannot be on the sidelines on this. You can't stand back and say it is always somebody else's issue and somebody else could take the lead. It is time for every healthcare leader to stand up and be the leader. And so let me indicate a couple of things that we've done, and then I'll make a number of other comments. 4 years ago, I took a full-page ad on the New York Times, and this was subsequent to a number of the mass shootings that occurred back then. And I just want to reiterate, and Fatima alluded to this also, that mass shootings are only about 1 to 2% of the problem. It's what goes on a daily basis, each and every day, that we're all familiar with, that is the biggest issue, not just the mass shootings. Of course, they get all of the attention that are horrific in their own right, but that's not the bulk of the issue. The issue is much more generic than that. But I took an ad out in the New York Times basically stating that healthcare organizations and healthcare leaders should use their collective power to come together and to deal with this as a public health issue. And inside our organization, and this is something I think everybody should do, because you need to create an infrastructure inside your organization to carry out your agenda. Because if you just talk about it and don't create an infrastructure to pursue the activities that you are serious about, it's really not going to happen. So we put together a Center for Gun Violence Prevention, and we staffed it and we financed it. And that is the epicenter of our effort inside the North Wall to deal with what it is we consider to be very, very, very important. And we have a wonderful leader, Chetan Sathya, who many people in this audience, I think, is familiar with. He's a pediatric trauma surgeon, and reminds everybody when he gets a chance to speak that his first patient as a resident was taking a bullet out of a 6-month-old baby. These kinds of stories, by the way, to audiences that sometimes don't want to listen to the argument here, these kinds of stories resonate. And I think that we should be using stories like this a little bit more. Then the other thing we did is we began to hold national forums, which we've done every year. We will be holding another one in a couple of months. We got funding to do research. So we do assessments of all people coming to our emergency rooms, assessing the potential risk they are with regard to gun violence. That is now implemented in pretty much all of our facilities. We started a learning collaborative, and these are organizations, healthcare organizations across the United States that engage with us every month to share information, exchange best ideas, educate one another. Hundreds and hundreds of people are on these meetings on a monthly basis. And we call it a learning collaborative for that purpose. And I can say this, that, and this makes me feel good, that 4 years ago, the number of healthcare organizations that were interested in actually getting involved, in my view, were very, very few. Today, it has blossomed into a much larger portfolio of organizations that are getting involved, and that's good news. Means that there are more people getting involved. And the other thing that we are just about to launch is a marketing campaign, and we have put together ads that will be on television beginning in about 2 weeks, and we have made those ads available to other organizations and other health systems across the country. We've paid for the whole thing. They can take it, and many dozens and dozens and dozens already have agreed to do so. And they, have to pay for marketing in their own community, but the actual groundwork has been done here. And this ad campaign is all about focusing on the home situation and urging families to ask other families whether or not, if they have a gun, whether it is on the lock and key at home. And the tagline is that it doesn't kill to ask. So if you're sending your kid to another family's home and you wonder whether they have a gun or not, there is no reason not to ask whether or not that gun is on the lock and key. That's a safety measure. So it's a very cleverly done ad. I think for those of you that will see it, I think you'll agree. But that is something that we are now making available to every healthcare organization, and for that matter, others that are interested, so that you can use it in your local markets. I've often remembered, the Partnership for a Drug-Free America and the ads that they've had for years and years and years. I think we need to do some similar things around the gun violence issue. And the other thing that I have just begun to do is I've sent letters to about 100 health systems around the country, to the CEO's directory, to see if we could create a health system CEO council on gun violence prevention, so that we get CEOs who are willing to put their name and join a council where we can actually advertise the fact that we have the top healthcare CEOs in the country willing to stand up and agree that they will participate in promoting gun violence prevention. Now, the other thing that we do locally, and I would urge that for those of people listening, and I know that Kaiser, Permanent, and others are doing a lot of this, that we have to work locally with every CBO that is interested in engaging in these activities, and there are many. We need to work with law enforcement, which we are doing, and we need to work with the schools to educate people about gun safety, which we are doing, and I think everybody should be doing it. And I think every school district should make this part of their agenda to be educating people about how we promote safety and prevention. And I think it's important for us all to remember that this is going to take time. We are in a world these days where everybody's looking for quick wins, quick successes. People are all short-term focused. This is not going to be the case with this. I agree with Fatima that we can definitely bend the curve, but we have to be resilient and persistent and stay with it over time. And I often mention the example we have with automobile safety. I remember very, very vividly, and I'm assuming that many people listening will remember this, especially the people who are of the older population, will remember Ralph Nader when he went out very, very publicly and talked about seat belts and airbags. And everybody back then, and I remember it very vividly, everybody back then said, well, you're a little bit crazy. This will never happen. Manufacturers won't do it. Regulators won't go along with it. The public won't accept it. People won't wear seat belts. This is a foolish journey that you're on. Well, let's move forward and look at today. You cannot buy a car today without seat belts and safety belts and airbags. And automobile accidents and death and injuries have decreased. Another example that we got to keep in mind is smoking. As everybody knows, I'm Irish. I grew up in Ireland, and when I grew up, everybody smoked. I never did. I can admit I never had a cigarette in my life, fortunately, but everybody did. And a campaign began a number of years ago to curtail smoking in public places. And I thought if there was one place that this could never succeed, it would be Ireland, because of the commitment people had to being able to have the freedom to smoke in public. Well, today, you don't smoke in public. You don't smoke in public. The campaign succeeded. So when it comes to the issue we're now dealing with, which I think is one of the more important issues we have to deal with, it's important to keep examples like that in mind. And I'm sure you can think of many others. And success will happen. It will take time. And the key for us who are engaged in this is to be continuously resilient, not to quit, not to get tired, not to treat it as a project, not to say this was last month's event or last month's effort, but to stay with it for years. And if we stay with it for years and continue to learn from one another, take examples from what HAVI has been doing, and have the organizations, healthcare organizations in particular, continue to share best practices, I think over time that we will make a difference. Things do change, and we have to be optimistic and positive about it. As the title of this program states, we're champions for change. And if we want to be true champions, we have to understand that change takes time. So I'm looking forward to engaging with everybody on this on a continued basis going forward. The United States is better than this. We should not be known as a place with a distinctive characteristic with regard to the death of children by guns. We should be known for a lot better things than that. And Fatima is correct. It is very targeted in certain communities. And we have identified 11 communities in our catchment area where we're engaged in a lot of direct activities, improving their lives and the circumstances in those communities to the extent that we can, working with others, so that we can over time reduce the incidence of gun violence. And it is multifaceted, as Fatima said. It is not like a one-trick pony where you can come up with just one thing to do and everything will just be fine. I wish it was that easy, but it is not that easy. This is a cultural change. This is a different way of thinking. And for leaders of organizations, we have to stand out front, take the heat, and you will get some heat, as I've gotten, but take the heat, stick with it, and if we do so, I think at the end of the day, we will be successful. So I know others that have been very heavily engaged in this would provide a lot of substance in the following talk. So again, it's my privilege to be here, my privilege to be an active member of HAVI, and delighted to have the opportunity, Fatima, to say just a few very quick words. So stay the course. Success will occur over time. Thank you, Fatima.
Excellent. Michael, thank you so much for your remarks. Really appreciate it. And we see already there are several questions in the chat about the CEO collaborative that you're building, as well as the ad campaign. And so if you have, or your staff have things to share in the chat,
Sure.
happy to hear greater information about it. I now want to turn our attention to our next speaker, Dr. David Grossman at Kaiser Permanente. David, the floor is yours. Thank you so much.
Thank you, Fatima. Really pleasure to be here. Also, thank you, Michael, for your inspirational leadership and remarks. Fatima, I want to really focus and congratulate you on your amazing leadership and dedication to this cause. I work for Kaiser Permanente, and I lead our efforts to integrate social determinants of health into our care delivery system as a means to achieve equitable health outcomes among our members. I'm also a former trauma care pediatrician, and I've devoted much of my career to violence prevention, especially gun deaths. As many of you know, Kaiser Permanente is the largest nonprofit integrated healthcare system in the United States. And as a nonprofit, we focus not only on our members' health, but also the health of the communities in which they live. So in many ways, actually, this event actually feels very much like a homecoming for Kaiser Permanente, because for nearly a decade, we've invested in a number of community-based violence prevention programs that try to address the root causes of violence and break those cycles of violence, as you were describing, both through behavioral as well as social interventions. We're headquartered in Oakland, as many of you know, and that's where our commitment to preventing gun violence actually first began. For about a decade or so, KP has been investing in those efforts to address violence, and largely initially through Northern California, although we have an 8-state footprint. But for example, we have partnered very closely with Youth Alive, which I know is on the program. We'll be speaking next. And that's Oakland's anchor organization for violence prevention, and includes also intervention healing. They are a national recognized leader in promoting these health-based solutions to violence. The Caught in the Crossfire program was actually the very first hospital-based violence intervention program in the world. And it started actually here in Oakland, and of course is now an international model. Now these programs exist in many locations thanks to the HAVI, and including the one that Youth Alive helped us establish in our Kaiser Permanente South Sacramento Trauma Center. So of course, to help scale up these kinds of programs, we provided seed funding to what was then known as the National Network of Hospital-Based Violence Intervention, now known as the HAVI. So I feel like we're coming full circle here. So safety, of course, is integral to the health and well-being of individuals and communities that we serve. And of course, violence is one of the largest threats to safety in the United States. And we began, of course, investing in this earlier on, but I think our thinking has been evolving, and in particular, we're becoming more focused on the issue of gun violence, which affects, as we've heard now, all of our communities, not only for the acute care injuries and the rehabilitation period that a number of our surgeons here are deeply engaged in, but also the intergenerational trauma that occurs over time, and something that we're very, very concerned about for both our members as well as our communities. As already described, we're experiencing some of the steepest climbs of violence we've ever seen, and certainly in my career. No thanks to the pandemic, and also as a direct effect of the gross health inequities that our society is currently experiencing. So I don't think I'm a pediatrician. I don't think I'd ever thought I'd see the day when firearm injuries actually would be becoming the leading cause of death among children and teens. But as you've all indicated, that is the case now. That's not acceptable. We have to do better. So clearly, Kaiser Permanente, and starting with our previous CEO, Bernard Tyson, and now with our current CEO, Greg Adams, we're resolved to take action, and we will continue to take action not only for the 12 million members in our group, but also the 68 million that live in the communities that surround those members. We want to be a community partner in this effort. So that's why in April of 2018, we pledged $2 million to fund research at a time where very few were actually funding any research, recognizing that's still a small amount of money. But for reference, in 1996, the CDC was funding research at about 2.6 billion and then had to stop because of congressional limitations. But at that time, we actually thought that our initial investment, which we wanted to, was considered to be a down payment, would inspire maybe other organizations to match that commitment and to increasing knowledge about gun injuries and deaths. And we were very thrilled to see a number of organizations come forward and do exactly that, which of course, and then following that, the CDC came forward with their funding. Some of the things that we have done through that initial tranche of funding was to hold a National Academy of Medicine 2-day workshop on the role of healthcare preventing firearm injury. And we brought together a whole group of experts, including some of the people on this call and from HAVI, to hear about what can happen, what can we do around prevention, and how can we increase the evidence base around that. We also funded 3 different research projects that were located in our research institutes, and in Colorado, and Seattle, and San Diego. We did that specifically to start to build a workforce or a research workforce within our system to take interest in these issues. And we're now starting to see the publications and some of the interventions come forth with that, primarily with a focus around the doctor-patient interaction, around counseling around guns, and understanding better how to reach people about safe storage, as well as the risk of guns, particularly in high-risk people. We also put together a delivery system task force composed largely of our Permanente physicians and nursing leaders about how we can integrate firearm safety into practice. And our teams decided to lock on to the pediatric focus as well, and developed a whole approach, including resources and workflows that would systematically address the issue of firearms in pediatric and adolescent care. And they piloted it in San Diego and was very successful. And we're looking forward to sharing those resources and scaling it further. So we're proud of that, but we recognize that wasn't enough and we have to do more. And that's why our CEO, Greg Adams, announced that we're establishing a new Center for Gun Violence Research and Education that will cement into place a long-lasting commitment to this area. It's still in its earliest phases, but we've already made an initial tranche of grants and awards totaling close to 1.5 million, including none other than the HAVI as one of those initial grantees. We wanted to send a signal to the community about who we'd like to work with and partner with in the future. So in conclusion, I think we all, as Mr. Dowling just said, there's obviously a lot to get done, and all of us have a role to play. But it doesn't necessarily mean we have to wait for someone else to take more political action or change a policy to actually get into and get moving. And I think the HAVI demonstrates that, both with its bipartisan work as well as its very focused work in the healthcare space. We know there's plenty of things that we can do now in the current environment. We won't solve this. It's not, as Mr. Dowling said, it's complicated. It's a syndrome. It's not a disease. And we have to tailor the cure and the healing to the specific type of violence, the types of weapons, as well as the physical and the social environment. So we do believe strongly at Kaiser Permanente that we have to apply public health solutions to this problem. We'd like to amplify and help the public as well as professional audiences understand what that really means. But we also need to understand and be clear that what underlies all of this, as Fatima said, was huge structural social problems that perpetuate and exacerbate this violence. It's not just guns in isolation. It's guns are the instrument, but behind all of that lays key issues such as racism, poverty, and injustice. We have to address the social tensions alongside that, and we know that we're all committed to doing so. So we want to join with you. We want to work with you. And again, thank you, Fatima and HAVI, for giving us this opportunity to speak to this important issue. Kaiser Permanente is really proud to be your ally and in the trenches with you. Thank you.
Dr. Grossman, thank you so much. We are indebted to Kaiser Permanente for your support when we were just in our founding and just your ongoing commitment to this effort. So deeply appreciate you. I want to now turn our attention to Paris Davis, who's at Youth Alive. I'm just so grateful, Paris, that you're here, not only because you are someone who's experienced violence, but also your work as a frontline worker. We cannot do this work without you and the professionals like you across the country who are doing this every day. So we're just honored to have you here, Paris, and the floor is yours.
Thank you so much, Fatima. I really appreciate that. Thank you, Michael and David, for both of what you do. It's very inspiring and helpful to continue to push the narrative. So my name is Paris Davis. I'm the intervention director at Youth Alive. Youth Alive is a violence prevention agency in Oakland. We'll focus on intervention and healing. So my first introduction to Youth Alive was a client. Growing up in Oakland, I'm not a stranger to violence. Both of my parents struggled from drugs pretty much the majority of my life for about 18 years. My introduction to gun violence, I was about a freshman in high school. From my freshman year to my senior year, I lost about 30 friends to gun violence. So not really understanding, trauma, not really understanding some of the feelings that I had definitely poured into my life. I kind of used basketball as an outlet for me. My whole focus was I didn't want to be a statistic. Being a person of color, there's a lot of statistics that are pointed at you, right? So my goal was really not to be that. So I was blessed enough to get a scholarship to play basketball. I was able to get my bachelor's degree. And once I came back, I had my daughter. So again, kind of on this fence of feeling like a statistic, kind of being a young father, still wanting to push through. And I received my bachelor's degree from Humboldt State University. I had just signed a contract overseas to be able to take care of my family. At the time, my dad had prostate cancer and my mom had MS. And I have a fully handicapped sister that I will have to take care of for the rest of my life. So with me, securing the contract that I did, it was about $250,000 that I was going to go to Australia and play. I just felt like my life was, aligning together. All the hard work that I had put forward, was coming together. And as I was coming home just to visit my family, an argument broke out at the recreation center that I grew up at, and shots rang out and I got hit. And I got hit in my stomach and it derailed, my hoop career forever. And I was just lost. I was very sad. I didn't know, I was just always asking why. And for the short amount of time, obviously I got addicted to the pain pills, just really trying to numb, how I was feeling. And it was a very, difficult time for me. My daughter was one. I didn't know, how I was going to provide for my family. I felt like I put everything into, basketball. I didn't consider myself at the time really academically savvy because I did just enough, right, to kind of get through basketball to, get through my goal. And once again, I felt like a statistic. I felt like, a young father and then, being victimized due to gun violence. One day when I was at home, I had a guy by the name of JD Rome stop by my house. He was the lead intervention specialist at that time at Youth Alive. And he came and talked to me. I was in a very dark place. I didn't know what I wanted to do. And he came and talked to me about just that, my life isn't over. I'm still here. What do I want to do next? And he kind of really started throwing opportunities out there that I could do. So I became a client at Youth Alive. And really understand the impact of having someone that looks like me come to my house and do a home visit and create me a life map. And I stand before you all today as the intervention director. I originally started, I'm so sorry. I'm so sorry, y'all. They're working on my house, so I apologize. But I stand to you all today. I started at Youth Alive as an intern because I wanted to be able to give back to my community. 4 years later, I'm the director of the HVIP that actually provided me services. So when I try to support individuals and do bedside visits, I come from a place of I understand, where you have been. And it just really holds a very special place in my life to continue to be a pillar in my community and continue to be an example. I recently just bought a house. I went back to school and got my master's degree. So, having the impact of HVIP, of creating a case plan and things like that, I came out on the other side and got away from hurt people. So with that being said, thank you once again, Fatima, for allowing me to tell my story. I appreciate you all. Sorry, I get a little emotional kind of talking about my journey because, it doesn't get easier. I'm always reminded when I watch movies and things like that. So it's an everyday struggle. So with that, thank you all so much. And sorry again for the background noise.
Paris, thank you so much. And we understand we're all totally understand the concerns working from home and having to navigate that, but we really appreciate that you're here and thank you for sharing your story. It's very, very impactful and continue to do this work every single day. I'm going to pass things off now to the HAVI's board chair, Dr. Rochelle Dicker, who has founded a program in San Francisco UCSF wraparound project. I'm just so thrilled as a leader, a national leader in this work, and also someone who's serves as a member of the American College of Surgeons Committee on Trauma. So Dr. Dicker, it's so good to see you. Rochelle, thank you. The floor is yours.
Thank you so much, Fatima. You are truly a champion of change. As I've said so many times, it's just extraordinary what Fatima has done with the HAVI since she renamed it from NNH VIP. And we couldn't be more pleased with her leadership. So I also want to lift up Paris's story. You realize, Paris, that you're not the only one emotional when you tell your story. You are a true hero, and you're the reason we do this work, to see that, to understand what an inspiration you are. So thank you for sharing with us that story. It lifts all of us up. It's really great to be here with all of the leadership from hospitals, from foundations, and with my chair of the Committee on Trauma, Dr. Jeff Kirby, who I'll announce in just a moment. I'm a trauma surgeon from Los Angeles, and as Fatima mentioned, the board chair of the HAVI. And as a trauma surgeon, you start really feeling like you're standing at the bottom of a waterfall or you're watching a revolving door. And you start feeling like treating the physical injury is just akin to putting a big, expensive Band-Aid on somebody. So it's critical for us to really go way upstream and look at the root causes of violence and work with our communities to address this. And HVIPs are a significant part of that solution in the ecosystem that Fatima lifted. Dr. Kirby will speak to you about the American College of Surgeons Committee on Trauma. But suffice to say that the Committee on Trauma's mission really is to promulgate excellent care of the injured patient throughout the United States. And this formal partnership that's been developed between the Committee on Trauma and the HAVI advances that mission. And together, and with all of you, we can create, and we are in the midst of creating a paradigm shift and a culture change in how we address community violence. Together, the COT and the HAVI can envision a holistic approach to our patients and our communities that is more about comprehensive care and addressing root causes together. And I'll leave you with a story. So Michael Texada is the supervising case manager at the Wraparound Project in San Francisco. He's a phenomenal human. When I worked with him up there, I would take a moment right before I was operating on an injured patient, and I would say a little prayer. As I got ready to operate, I would say, I need to just keep this person alive so that Mike can help him thrive. And that really is the crux. It's the backbone of our programs, our credible messengers, their lived experience experts. And it's so extraordinary to be at the table with their leadership to create these programs and to bring them to hospitals across our country. So with that, thank you, Fatima, for the opportunity. Dr. Jeff Kirby is the Division Chief of Trauma and Acute Care Surgery at the University of Alabama. And we are so fortunate that he is now the chair of the Committee on Trauma, American College of Surgeons Committee on Trauma. So Dr. Kirby, thank you for joining us.
Well, thank you, Dr. Dicker. I really appreciate that. And I'm really honored to be here to ask to say a few words today about our partnership with HAVI and give our perspective on why we feel these hospital-based violence intervention programs are so important to what we do to help our patients. I am Jeff Kirby. I am a trauma surgeon. I'm based in Birmingham, Alabama, where I run a very busy trauma center. And since March of this year, I've been the chair of the American College of Surgeons Committee on Trauma. For those of you who don't know, the American College of Surgeons is really the largest and really the most well-recognized surgical organization in the world with about 84,000 members. The COT has been proud to be a part of this organization for 100 years now. So we're celebrating our centennial this year. And, our main goal is, as Dr. Dicker said, was to really improve outcomes, improve trauma care for the patients that we serve. We have four main pillars to our mission. One is a quality mission. We verify trauma centers. Not every hospital is a trauma center. Not every hospital has the resources required to take care of trauma patients at the highest level. So we verify those trauma centers, make sure those resources are in place and they have the best outcomes. We also help develop trauma systems. As I said, not every hospital is a trauma center. Not every community has a trauma center available to them immediately. So we have to develop systems of care to make sure the injured patient gets to the right hospital in the shortest amount of time to provide definitive care and the best outcomes for those patients. We also have an education mission. We developed a portfolio of education programs that we actually provide worldwide. We've taught these programs. Our Advanced Trauma Life Support Program is being taught in 112 countries around the world. It's been translated into 9 languages, and we continue to promulgate those educational resources to help decrease preventable death from injury. But a big focus over the last several years has been on injury prevention. It's really become a major focus, and we have several programs that are in place right now. Dr. Dicker is leading the iSave work group. This is improving social determinants to attenuate violence, has developed a trauma-informed care curriculum that we're now pushing out to our trauma centers, which has been very transformative for us. And she's really led the way and really informing the trauma community about the need for this and about ways to address community violence. So she's been a fantastic leader for our program. Just weekend before last, we hosted at the American College of Surgeons office in Chicago our second medical summit on firearm injury. Dr. Dicker was moderated a session on addressing community violence. Fatima was one of the key speakers for that session. It was well attended. We had 47 different medical organizations attend that conference. And we came out of that conference with a commitment to continue this work. That was very, very, it was a great conference and a lot of great discussion. And there's a lot of initiatives coming out of that. And one of those being a commitment to hospital-based violence intervention programs and our work with the HAVI. As an organization, we see the value in having credible messengers with a similar lived experience provide support to patients who have been injured from firearms. It's so valuable to at that moment in time to have that resource available to get resources they need to really break that cycle of violence and prevent recurrence of that injury at a later time. Our Birmingham story, if I can just talk a little bit about that. We see about 7,000 trauma patients a year in our trauma center. About 20% of those patients are from firearm-related injuries. So we're seeing about 1,200 to 1,400 patients per year with firearm-related injuries. Just for perspective, about 10 years ago, we were seeing about 280 trauma patients with firearm-related injuries. So it's been a significant and linear increase. It's increasing every year and really bumped up dramatically during the pandemic. But this is a major part of the work that we do. Our county health department recently did a community survey, and the results were that the number one health issue for our community was firearm injury. And this really served as a catalyst for us to work with the county health department and our trauma center, work with community-based organizations who had been working in this space for a long time, as well as our public health professionals or civic leaders to develop the hospital-based violence intervention program. And the HAVI has really been a major part of that process. We had attempted similar programs in the past that really were not sustainable. And the HAVI has provided a very structured process to do this, a very thorough process, bringing all the stakeholders together to make sure that we not only build a program, but we can sustain a program over time. So this has been really, really key to the success of building this program in our community. So hospital-based violence intervention programs are very important to the American College of Surgeons, extremely important to the Committee on Trauma within the ACS. We're actively encouraging our participating centers to develop these programs. We're very interested in working with the HAVI and seeing the standards that they develop and seeing how we might be able to potentially incorporate these standards into our own standards for our trauma centers moving forward. So happy to partner with the HAVI on these efforts, and I do appreciate the invitation to be here today and to provide some remarks. So thank you very much.
Dr. Kirby, thank you so much, and not only for your leadership, but hearing about what's happening in Birmingham and that incredible increase in violence. We are certainly seeing that across the country following and during COVID, and certainly it's continued. And as you know, I think I shared with you, my family is from Alabama. I have family, loved ones in Birmingham. And so it's something that I'm paying attention to every day. So really, really appreciate your work and really look forward to continuing our partnership with the Committee on Trauma. Thank you. I want to now shift gears. We've talked a lot of healthcare talk, and it's very, very important, but I want to impart that there are many other stakeholders that are involved in this work and this fight. And so I'm grateful to introduce our next speaker, Nina Ravor, Executive Director, Los Angeles for the Ballmer Group. Nina, it's so good to see you, and the floor is yours.
Great. Fatima, thank you so much. I'm so honored to be here. Thank you for the invitation. Incredible to be sharing this stage with all the other speakers. Thank you for your remarks, and Paris especially. Thank you for grounding us in the real and the tangible in your story, which I know is not easy to share. As Fatima mentioned, I'm Nina Revor. I'm joining you today from Los Angeles, where I lead Balmer Group's giving, both in LA County and California. I also work nationally on issues related to public safety, including leading the work for our $18 million in recent funding to support community violence intervention. Balmer Group is supporting a group of 4 community violence intervention training and technical assistance organizations, including the HAVI, to lead a coordinated multi-city effort to reduce gun violence. And I want to talk about 2 things today. First, how this particular initiative came about. And second, why a funder who is focused on economic mobility, as we are, got involved in community violence intervention. So first, the initiative. In the fall of 2020, we started having conversations with Fatima, as well as a few other leaders in the violence intervention space. And through the process of those conversations and listening sessions, we learned that these key CVI technical assistance organizations, who had different focuses and specialties, and Fatima talked through that a little bit, have mostly worked separately and independently over the years. They'd sometimes been in the same cities or the same places, but not in a coordinated way, and they had never been funded to work together. And they all thought that they could have more impact if they could work collectively and join forces. So this was especially important because with the new administration, there was a greater awareness of violence intervention approaches and the potential for a lot more public funding, as we're seeing starting to come to fruition. And the HAVI and their partners wanted to make sure that the field was ready. So we asked these 4 leaders to develop a joint concept about how to approach working in cities in a deep, coordinated way, how to collectively assess need, the existing infrastructure, political will, the kind of staffing and training needed, et cetera. They believed that if they were able to do this, they could do more than ready the field, but that they could actually help reduce gun violence in a measurable way over time. So we funded the groups for a total of $18.25 million over 5 years. We gave direct grants to all 4 of the organizations, which were the HAVI, the National Institute for Criminal Justice Reform, the Community-Based Public Safety Collective, and Cities United. And they called themselves the Core 4. We wanted to support the organizations individually, but we also wanted to provide them the support, the space, and the time to think together as a group. Now, I want to say very clearly that this was their initiative, their idea. They jointly developed the milestones and goals and metrics. They chose the cities. I say this because sometimes for shorthand, they and others refer to this work, this initiative, as the Balmer Initiative, but it is not ours. It is theirs. So Fatima, y'all are going to have to come up with a different name for this work. Second thing I want to talk about is, why is Balmer Group even funding community violence intervention? As an organization, we are focused on improving economic mobility for low-income kids and families and on reducing systemic inequities. That means we work on things like education, child welfare, youth development, workforce, affordable housing, et cetera. But we also recognize that safety is foundational. We consider safety as a precondition for economic mobility. Now, several years ago, when Balmer Group got started, I made the point to our founders that without safety, you can't have anything else. The best reading program in the world is not going to help a kid if it is too dangerous for him to get to school. So to respond to those challenges, we funded some work around public safety in Los Angeles, largely gang intervention and street outreach work. We also funded a great hospital violence intervention program in Detroit, D-Live, which is actually where I met Fatima several years ago, as well as some work in Chicago. And we supported some broader efforts around criminal justice reform. But then why did we go from funding local CVI work in a couple of places to trying to make a bigger impact at scale? Well, for one thing, it's because Balmer Group has a specific particular focus on young Black men and mobility. And obviously, young Black men are disproportionately impacted by gun violence. For another, we support CVI quite simply because we know that it works. Others have talked about the evidence base and the research, so I'm not going to repeat that. And that's obviously important. But I also want to say that we have seen CVI in action personally. For those of us who've been driving this work internally within Ballmer Group, community safety is not academic, it's not theoretical. Many of us have worked and lived in communities that are impacted by gun violence. We've lost young people we know. Some of us have lost friends and family members. Before we came to philanthropy, a couple of my colleagues and I worked in settings here in LA where we work closely with and really depended on gang interventionists and violence interrupters. We know of the shootings that they witnessed, the retaliations that they've stopped. We know about the loved ones that they have lost and the trauma this has caused them and the broader community. We know that they have risked their own lives to keep their community safe, doing work that's not always recognized and never, almost never sufficiently monetized. So we have seen this up close and personal. We know the violence they've interrupted and prevented. I still get text messages, as I've shared with Fatima, from a gang interventionist friend whenever there's a shooting in Watts. So this work is deeply important to us personally. And I am gratified that community violence intervention is now getting the kind of recognition that it is, and honored to have had a part in helping to support it. Now, going back to the 4 CVI groups, the core 4, the time I've gotten to work with them over the last couple of years has just increased my admiration for their leadership, their innovation, and their vision. And I really want to underscore the critical role of the HAVI and Fatima's particular vision and leadership. She is what brought this initiative together. Her ability to set the tone, to communicate the work, to collaborate, to analyze and assess the data has been critical. Now, you may know a little bit about my boss, our co-founder, Steve Ballmer. He kind of likes numbers and data. Fatima developed this complex Excel spreadsheet to talk about the numbers of staff members that were needed of each particular type in order to meet the ratios that are necessary in each city to address the problem. All I can say is that the spreadsheet made my head hurt, but it was catnip for Steve Ballmer. And I say this because the ability of Fatima and her partners to talk credibly about community and also go toe-to-toe around things like data and evaluation and evidence has been absolutely remarkable to witness. So we're very excited to see this work evolve and deepen. And I just want to close by saying that this is a key moment for community violence intervention. It's enjoying a different kind of attention and credibility than it's ever had. President Biden mentioned it in the State of the Union address a few months ago. But the field needs more believers, more friends, more supporters. Additional support is needed around infrastructure, around sustainability, around data, research, and of course, for the direct work on the ground in cities. So we hope that more people will join the movement, join us. And again, we are deeply grateful and honored to be part of this work. So with that, I will turn it back over to Fatima.
Nina, thank you so much. There were several times during your remarks where I laughed out loud in my room. So thank you so much just for your support and again, believing in us, believing that this work is valuable. You're shepherding us throughout this over time. This is the critical thing about partnership. When we say partnership, we really mean it. The questions you ask, the coming to sit at the table and think together about things is actually what's going to lead to the success we seek. Nationally, we need everyone truly, and Nina, you specifically, and the Ballmer Group, Stephen Connie's commitment personally involved in this has just been absolutely remarkable. And many of your staff who've sat with us in rooms, that's what we're going to need to continue that partnership, that true sense of the word partnership. So thank you very, very much. And I want to then pass things on to our final speaker, who's gonna close us out. Before I end, Dr. Marvin Carr, who is a director at the Center for Racial Equity at Walmart. Marvin, you all are in for a treat. I have such admiration for Marvin, how you think. So I'm going to pass things on to you. The floor is yours.
Thank you so much, Fatima. It's so great to be with everyone today. And I'll get to the point. Like, some people ask the question, like, what does Walmart care about community violence intervention? And the way that I talk about it is that in communities where customers feel safe walking from their home to their neighborhood markets, where customers feel safe walking from their car through their Sam's Club parking lot, and where associates feel safe dealing with customers. Walmart thrives, but also the community thrives. And that's one of our main, one of the reasons for our focus in criminal justice and supporting this work. Following the murder of George Floyd, Walmart did two very important things, I think. One, it started within the company 4 shared value networks that asked, how might Walmart address racial inequity in the system that it is involved in? And it also started a 5-year, $100 million philanthropic initiative called the Walmart.org Center for Racial Equity, focused on 4 areas: health, wealth, education, and criminal justice. And our work seeks to advance systems change in those 4 areas. I oversee our criminal justice work. And as a person who is directly impacted by this work, one of the things that I first realized when I joined is that so many in the funding space, but also in the corporate space, approach the criminal justice system at the back end, focusing on decarceration, second chance hiring, those sorts of things. And I recognize I come from the policy world. I spent several years at the White House on the policy, and I recognize that oftentimes the nonprofit space, the research space, the think tank space follows federal policy. And so Obama era and Trump era policy really focused primarily at the back end of the system. But I think we all know that the criminal justice cycle system is not linear, right? It is not this linear spectrum from prevention to aftercare. In fact, it is a harmful intergenerational, intercommunal cycle. And if we don't do the work on the front end to break the cycle, if we don't swim upstream to stop people from jumping into the river in the first place, we are not doing systems change work if we're not doing all those things. And so while the company is focused on how it might use its resources to support those who are leaving the criminal justice system with work, we're also focused now, both the company and the foundation, on addressing the front end. How might we prevent young people from entering prison and the criminal justice system in the first place? And so our focused and our philanthropic area are in funding several networks that we think are essential to bringing about systems change and policy and programming. And all these things are really grounded in this idea that until we shift the mental models of Americans and those who run the different systems, it's going to be very difficult to actually bring about change. And so when I first heard from Fatima on the work at the HAVI, it was so important for me, right, as a grant maker, and as a person working in corporate philanthropy, to really honestly ride the coattails of HAVI. The work of deep systems change require narrative building. And so much of the work that we are doing at Walmart and others are doing in the space around prevention sits on narrative building. The problem with prevention and philanthropy and prevention and research is it's very difficult to measure success of prevention. Same thing with the HAVI work. It's very difficult to measure return on investment on intervention because you are actually doing the work to cause something to never happen in the first place. And the scientist in me, the engineer in me, sometimes interferes with the philanthropist, with a person in philanthropy. And one way, though, to measure prevention is to measure, and this is going to sound crazy, but the measure the change in people's sentiment about a group. And I think that is what the partnership that we're really hoping to and have been having with HAVI is really focused on. So primarily, I'll spend just a few more minutes, Fatima, we don't have that much time, talking about what we are funding and how this fits in this. We have the funded studies that ask the question, who are the most likely Americans to go to jail for the very first time? And they have several things in common. They were in or aged out of foster care. They had parents who were in jail when they were under the age of 18. They themselves were involved in juvenile justice as when they were under the age of 18. And or surprisingly, they were involved in trafficking of some sort. And so what we are doing at the Walmart Foundation and encouraging other funders and other folks in the space to do is, how do we focus on the idea of deflection? Before a young person experiences the harm of the justice system, experience the harm of facing police or a judge, how might we provide opportunities in workforce, in mentoring that shift them towards their full potential, instead of what we know is probably a direct line to prison. And so we are funding some really awesome things. For instance, our Unlock Potential program, which is working with Delta Airlines, Walmart, Sam's Club, Ben & Jerry's, so many great companies to build intentional hiring pathways for the young people we know are at the highest risk of incarceration and gun violence. How do we go on the front end to prevent that from ever happening in the first place? And then I'll get to the next point, which is for those who do end up in front of a police officer or in front of a judge, how might we actually support criminal justice system actors in shifting the narrative about how they feel about these young people, or about how the public feels about them, in order to really create this sense of community, the sense of second chances at every level of the program. HAVI fits into the part of our portfolio that really focuses on how do you shift the way that decision makers about who goes to jail, who doesn't, who deserves an opportunity, who doesn't, how can we give them more information to give more people second chances? And it also really leans into this idea of how can we really get the American public, those in the press, those in the media, those who actually help to create and shape mental models, how do we give them more opportunity to learn about the greatness and the assets of the young people and why they deserve second chances, and why a program like HAVI, which not only gives people second chances, but actually will, and the data shows, provide communities a second chance to thrive. And so super excited about all this amazing work, and even more excited about what's happening next.
Incredible, incredible. Thank you so much, Dr. Carr. You are continuing to lead and really bring others with you. I think your work just supporting networks and thinking about networks is very, very powerful. That engineering background's really serving you well. Please join me in thanking each of our speakers. I've just been incredibly moved and just so deeply encouraged by your words and our ongoing work together. And so I know that we're a few minutes over time, so I will conclude briefly with a call to action. We had over 120 participants in our event today, and many more who've registered to review our recording following. We will be sure to send that out to you. For those of you tuned in, I invite you to share in the excitement of this moment and the opportunity to scale your impact. And we've got a few ideas for you. We have a link that shares more information about these. So I'm just going to do very high level. We want you to join a multi-sector, multi-sector, I'll say, strategy group to help us focus on how we can amplify and grow this movement. So we want your ideas. We want to really think about how to drill down on our strategy. I want to invite you to meet with me individually to actually explore opportunities for partnership with the HAVI. If you're interested in a partnership with us, we were exploring corporate employee giving programs. We're very excited about thinking lots of different ways that partnership can happen. We invite you to come and see implementation on the ground. You want to see Paris and others who have done tremendous work locally. Nina mentioned in her remarks that she and I met watching one of our member programs, connecting with one of our member programs in Detroit, D-Live. That work is remarkable, and nothing replaces seeing it live. And finally, spread the word. We've shared this national poll. We need to see many more polls like this. We need to continue to shift sentiment, as Dr. Carr said, and continue to enjoy, I think, the momentum we're experiencing across the country and to maintain that bipartisanship. So finally, please join us, next slide, in our virtual conference. It will take place November 1st through the 3rd. It's about building the CVI ecosystem. We have the CEO of American Psychological Association, Dr. Arthur Evans, will be one of our featured speakers. And I saw one of the questions was about how to build a mental health infrastructure. So we'll be addressing that in our talk. And so we unfortunately don't have time for questions, but we thank you. We see many have been responded to in the chat. Thank you so much for your time. Again, a special thanks to our speakers, and have a wonderful rest of your day.